does natural remedies and natural supplements, do they have a place in medicine with those people who are chronically ill? What would you say? Okay, what's your answer? So I would say mine is obviously yes, there is room for natural supplements, natural remedies, or, obviously healthy eating, healthy lifestyle, right? Eating, exercise, movement, all those things are super important as well when it comes to chronically ill patients in medicine. Okay. So, what I will throw out there is sometimes when people have multiple chronic illnesses, um, they have had these a long time, right? They have varying stages of chronic illness. Their diseases have advanced over time with age, different things like that. That sometimes those remedies, right, may have to take be on the back burner, right? Sometimes you get to a point in life, especially when taking care of geriatric people, you've gotten to a point in life where those interventions no longer work, right? Or you haven't done those interventions your whole life, so it's not going to make, an extreme difference at 80. Or it can help, but you are not there, right? Or you have the patient who is not willing to meet you halfway with some of those lifestyle changes and things like that for those natural remedies and exercise and natural lifestyle to be effective. Um, I say this because I've experienced like families asking questions about why some patients are on long laundry lists of medications. And I think it's a really good question because there are situations where patients are seeing multiple providers and we're just adding meds, right? Side effect, side effect, side effect, or this one's taking care of this and this one's not looking at this. And I understand that. So it is a really good position to be in to question those things. I will also say on the other side of it that when diseases are chronic and progressive, um, patients often will be on a multitude of medications. You know what I mean? And working in this environment with patients, I mean, it is not uncommon for one patient to have heart disease, high cholesterol, kidney disease, diabetes, depression, anxiety, um, heart failure. You know what I'm saying? It is sometimes these patients have multiple things, right? Which again makes their list a little bit long because they have tighter control for blood pressure depending on the age. They have tighter control for cholesterol levels. Diabetes is going to vary based on the patient's age. But again, sometimes with these conditions, it takes more than one med to control that, right? And then you might have more than one med to control another condition. So it's not uncommon for people to be on a multitude of medications. And I think, again, it's great, ask those questions, but sometimes we are beyond natural remedies in certain disease stages. Patients and individuals have to be willing to meet providers in the middle, right? So maybe some medications can be foregone, right? I'll do a second video because this one's getting long.